Contrasting results of reduce-it and strength trials of omega-3 fatty acid preparations have caught the attention of scientific community. Icosapent ethyl, a highly purified eicosapentaenoic acid ethyl ester, was evaluated in reduce-it study. In strength trial, carboxylic acid formulations of eicosapentaenoic acid and docosahexaenoic acid were used. Reduce-it was a multi-center, randomized, double-blind, placebo-controlled trial. Patients enrolled had established cardiovascular disease or diabetes with other risk factors. They were receiving statin therapy and had fasting triglyceride level between 135 to 499 milligrams per deciliter and LDL cholesterol between 41 to 100 milligrams per deciliter. Primary endpoint for the reduce-it trial was a composite of cardiovascular death, non-fatal myocardial infarction, non-fatal stroke, coronary revascularization, or unstable angina. Key secondary endpoint was a composite of cardiovascular death, non-fatal myocardial infarction, or non-fatal stroke. Of the total 8,179 patients enrolled, 70.7% were for secondary prevention of cardiovascular events, and median follow-up was 4.9 years. Primary endpoint occurred in 17.2% of the icosapent ethyl group compared to 22% in the placebo group. Key secondary endpoint occurred in 11.2% and 14.8% respectively. A higher incidence of hospitalization for atrial fibrillation or flutter was noted in the icosapent ethyl group, 3.1% versus 2.1%, p is equal to 0.004. Serious bleeding events occurred in 2.7% of the icosapent ethyl group compared to 2.1% in the placebo group, p is equal to 0.06. Reduce-it CABG was a subgroup analysis of 1,837 patients from the trial with a history of coronary artery bypass grafting. Icosapent ethyl group had significant reduction in the primary endpoint, key secondary endpoint, and total ischemic events, first plus subsequent or recurrent ischemic events. Strength was a double-blind, randomized, multi-center trial comparing omega-3 carboxylic acids with corn oil. Participants were statin-treated patients with high cardiovascular risk, hypertriglyceridemia, and low levels of HDL cholesterol. 13,078 patients were randomized at 675 academic centers in 22 countries across 6 continents. Primary efficacy measure in the strength trial was a composite of cardiovascular death, non-fatal myocardial infarction, non-fatal stroke, coronary revascularization, or unstable angina requiring hospitalization. The trial was halted prematurely as an interim analysis showed a low probability of clinical benefit. Primary endpoint occurred in 12% of patients in the study group and 12.2% of patients in the control group, p is equal to 0.84. Greater rate of gastrointestinal adverse events were noted in the omega-3 carboxylic acid group, 24.7% versus 14.7%. There was a concern that docosahexaenoic acid could negate the beneficial effects of eicosapentaenoic acid, as icosapent ethyl had shown benefit in the reduce-it trial. A secondary analysis of strength trial checked this out. It was concluded that the highest achieved levels of eicosapentaenoic acid and docosahexaenoic acid were associated with neither benefit nor harm in patients at high cardiovascular risk. Another small study, the EVAPORATE trial, which enrolled 80 patients, checked the effect of icosapent ethyl on coronary plaque regression by serial multi-detector computed tomography. Icosapent ethyl demonstrated significant regression of low attenuation plaque volume on MDCT compared with placebo over 18 months. First set of journal references. Second set of references. One more reference. Thank you for watching this video. Please subscribe, like, share and post your valuable comment below this video. Kindly press the bell icon after that for getting all updates.